What to do if your nose hasn't been breathing for years? Indications for plastic surgery. I often meet people who have been suffering for years. They can't breathe, they use various drops, vasoconstrictors, hormonal, they refer to some kind of alternative medicine or nutrition, but unfortunately none of this works. There is a simple operation that can fix this issue and solve your breathing problems once and for all, and that is rhinoseptoplasty. Be sure to watch this video all the way through. We will go over all the stages of this surgery. For this operation, for rhinoseptoplasty, I believe there are two main indications. The first is the functional, that is when you have no nasal breathing. And the second is the aesthetic. If we are talking about the functional component, then how to check it, how to understand it, how to know if you have any problems. Sometimes people can't breathe at all, and sometimes the breathing function is suppressed, but it is somewhat present. There are a few simple ways. Just try to take a deep breath and exhale through your nose and understand if you have enough oxygen or there is a feeling that it is a little lacking. The second point, you may wake up at night and feel that your mouth is dry and you have insufficient breathing. You wake up in the morning feeling exhausted, not fully rested, even though you went to bed early. This is a clear indicator that during sleep, hypoventilation occurs, or simply put, there is not enough oxygen. The brain does not receive sufficient oxygen, and all functions suffer from this. You wake up broken with a feeling of lack of sleep, and chronic fatigue arises. This is the main point you should pay attention to, and you need to see an ENT doctor to check the positioning of your nasal septum. And if you notice that you have breathing problems and you have some symptoms and you are eager to learn about the operation and the possible ways of treating this problem, then like this video. How does this surgery take place? The surgery is performed under general anesthesia. There are various approaches, open and closed methods. It is important to understand what task we are solving. If we came to solve a functional problem, it is one thing. If we came and asked the surgeon to solve both the functional and aesthetic problems, it is another thing. This is the difference between rhinoplasty and rhinoseptoplasty. When we do septoplasty, we eliminate problems with the septum, normalize nasal breathing, and work with the mucous membrane. We do everything to restore the functions of normal breathing. If there is also an aesthetic component, this surgery will be called rhinoseptoplasty. In addition to working with the septum, we will work with the external structures of the nose, the bone and cartilage parts, to achieve the desired aesthetic result. In my clinic in Dubai, we perform both types of operations, septoplasty and rhinoseptoplasty. We solve any tasks and needs of the client, both functional and aesthetic. Therefore, if you want to trust professionals and solve the problem, follow the link in the description. Sign up for a consultation to permanently solve your breathing problems or any aesthetic issues. How does the operation go? At the preoperative stage, it is very important to do a CT scan to understand the position of the nasal septum and the overall structure of the nose. If we are talking about aesthetic components, now there are many graphic programs where you can upload your photos. In these programs, we can model the final result at certain angles. This helps to predict the outcome that we can achieve as a result of the surgery on the external part of the nose. It happens that patients sometimes do not mention important details. For example, they may not mention that a year or two ago they already had a septoplasty. If we neglect this information and did not do a CT scan, possibly due to overconfidence or other reasons, it can lead to complications. If you don't do a CT scan before the surgery and the patient has a chronic inflammatory process such as sinus infection, then after the surgery, inflammatory problems may arise in the area that underwent surgery. This happens because we did not do a CT scan before the surgery and did not identify the chronic infection focus such as sinusitis. The second step is the surgical treatment. There are open and closed methods of surgery. The open method involves making an incision in the area of the columella nasi, or in other words, the fleshy external end of the nasal septum. We lead the incision along the vestibule of the nose, aka nasal passages. Correspondingly, all this is strictly performed in accordance with the rules, and we access the structures of the nose, improving the cartilage part. There's an interesting point when we make small videos before and after the surgery. We make sure to create collages from the photos taken from the operating table. Very often in the video, we show how we press the tip of the nose with our index finger, demonstrating how the nose collapses down, having no support structure. This is important because over time, cartilage tissue can grow. As we get older, ears and the tip of the nose become shapeless and begin to sag. Many people have such features. These are individual genetic characteristics of their anatomy. It happens that when pressing on the tip of the nose, it collapses like a button. After the surgery, we show that by working with these structures and the nasal septum, the tip of the nose becomes firm. When pressed again, it no longer collapses, but remains a solid structure. A support structure appears that holds the shape of the nose. This is a very interesting surgery with which you can solve both functional and aesthetic problems. It is difficult to describe this surgery in simple words because each case is unique. There are many nuances and details related to working with cartilages. Sometimes we use various grafts. There are many nuances and details related to working with cartilages. Sometimes we use various grafts. So what are grafts? We use cartilage tissue. This is when we take cartilage from the auricle and use it to work with the septum to strengthen the alar cartilages. Sometimes we take cartilage from the rib. Sometimes there are situations when you can buy ready-made cartilage or so-called allogenic graft. This may be necessary because, as we said about septoplasty, what does septoplasty mean? There are problems with breathing, there are deviations of the septum, there are curvatures. We must solve these problems to eliminate the breathing problem. This is one situation. There is a situation when an aesthetic aspect is added to reduce the tip of the nose, make the nose at the base narrower, more aesthetically attractive, right? For example, the patient has a bump on the nose. You need to remove the bump. If it does need to be removed, you also need to work with this task. And there are completely different stories. For example, the patient already tried to do septoplasty or rhinoseptoplasty, but the task was not solved, but instead got worse. There was a deformation, the alar of the nose is deformed, breathing problems intensified, or there are situations when the surgeon tried to solve functional breathing problems, but actually made it worse. For example, what got worse? An opening appeared. This is already serious. Deformation means that the patient had breathing problems and could inhale air, but it seemed to him that there was not enough air. He went to improve nasal breathing, but got a small opening in the nasal septum. As a result, air stopped passing altogether, and the situation worsened as the air began to circulate between the entrance to the nose, this opening, and the exhalation point. A vicious circle turned out. From a small micro opening, it can grow into a huge hole. And this is already a defect of the mucosa and the septum. In this case, reconstructive septoplasty is needed. Here, as a rule, either the use of autologous material or a skin graft is required. The skin needs to be grafted out from somewhere and unfolded to restore the septum. Actually, everything is very case-specific here. If we speak roughly, we could say the nose was opened, then closed, but in fact, this is a rather serious surgery. Actually, it is considered to be as one of the most complex in plastic surgery. By the way, write in the comments which operation you would like to attend personally. Write about it in the comments, and if I see your interest, I will be able to organize and make an online demonstration directly from the operating room for you. The next step, after opening, we will work with the nasal septum and then move on to the tip of the nose. Accordingly, if required, we will work in the area of the bones. Accordingly, if our task is to make the nose narrower at the base, we perform posterior longitudinal osteotomies. For this, we work with special instruments using the so-called piezoelectric surgery method. We work in the area of the nose hump, remove the hump if it is present, then we smoothly move down to the area of the cartilaginous part of the nose. We work on the tip of the nose, correcting the cartilage. We strengthen and install the so-called spreader grafts using various grafts. We work on the supporting structures of the nose, which allow the tip of the nose to be slightly raised and more rigid. We work in the area of the right and left alar cartilages, solving aesthetic issues. If there is excess skin and we need to reduce it, sometimes we place the so-called auxiliary sutures to improve the condition of the skin. These sutures are placed in the area of the tip of the nose and are temporary. They are removed after a while or fall off on their own. This allows the skin to shrink significantly, which is very important. If we continue to talk about the functional problem, namely about the function of breathing, then, as we have already discussed, it is very important to understand what is happening with the septum. Because the septum, as a rule, is either curved to one side or the other, this is called deviation. There is also an S-shaped curvature of the septum. There can be various bony spurs and growths in the nasal cavity. All these factors affect the mucous membrane in the nasal cavity, making it constantly irritated. Constant exposure causes hypertrophy of the mucosa, which leads to constant nasal discharge. Plus, as a rule, trying to improve our breathing, we use various constrictors or vasoconstrictor drops. All this leads to hypertrophic changes in the mucous membrane. And what do we have? We have a curved nasal septum and overgrown mucous membrane in the nasal cavity. Accordingly, nasal breathing is maximally narrowed and air simply cannot pass through such airways. We must eliminate the problems with the deviated septum, making it straighter. If there are curvatures in the bony section or spurs, we remove them. We reperform osteotomy, placing the septum in the correct position. Accordingly, if we are talking about the cartilaginous part, we resect the mucous membrane in some areas, make incisions in others to weaken or give it the correct, straighter position. We nibble various bony cartilages, remove excess mucosa. We use energy to reduce the mucous membrane. All these manipulations improve the quality of breathing after the surgery. It is very important to install not tampons, as before, but the so-called splint systems. These are devices in the form of silicone or plastic tubes which are flat on one side and in the form of a half tube on the other. Through these half tubes you will be able to breathe, of course not completely, but at least 30–40% of breathing will be back immediately after the surgery. The flat side of the splints touches the septum on both sides, holding it in the correct position, allowing it to heal and preventing complications such as synechia. This is when, roughly speaking, after the surgery, swelling appears in the nose and the mucous membrane begins to stick together, forming small adhesions. These adhesions cause significant discomfort to the patient and interfere with breathing. Therefore, splint systems are very important for holding the septum in the correct position and preventing such complications as synechia. Therefore, it is very important to wear splint systems for the full term and not to ask the doctor to remove them early. Typically, patients often ask to remove them early because they cause discomfort in the first 3 days. However, do not ask the doctor to do this. Wear them fully so that your breathing becomes perfect and you do not require additional manipulations. And after all, what are 2 weeks compared to a whole lifetime?